Hi friends, welcome back to Coffee with Ravi. This month we are doing some liver cancer awareness, and I wanted to put out some material that may give you a sense of what's liver cancer. It's a broad group, what we can do, who's at risk for it, what we can do to catch it early, and how do we even prevent it in the first place. I'm talking about hepatocellular cancer. Hepatocellular cancer is the most common cause of liver cancer. There are, of course, other liver cancers in layman's terms when we talk about it, and I'll go over it in the next slide. But hepatocellular cancer is cancer arising from liver tissue. It develops usually in the setting of cirrhosis of the liver. So one needs to develop liver scarring. I've in the past posted cirrhosis and will link my cirrhosis video to this. But cirrhosis is a condition where the liver gets damaged over a period of time, either because of fat in the liver, chronic hepatitis C, which is a viral condition, chronic hepatitis B, which is a viral condition, among other things. However, there are some conditions where the hepatocellular cancer can develop without having cirrhosis, and the prime example of that is chronic hepatitis B. Chronic hepatitis B is a condition where the liver has infection. Hepatitis B is acquired through IV drugs, through blood transfusions, through tattoos, through unprotected sexual activity. These are the primary ways, and once it stays in the body, it continues to damage it, and you don't necessarily need to get to cirrhosis to get liver cancer. It's very silent, and therefore early treatment is important. Now, as opposed to hepatocellular cancer or HCC that we talked about, there are many other cancers that are in the liver. For example, there's cholangiocarcinoma, which is a bile duct cancer. There's angiosarcoma, which is a cancer of the blood vessels. There's hepatoblastoma, which is a very rare cancer, mostly in children. And of course, the most common type of cancers we run across is when what we call metastatic or secondary cancers, where cancers from the colon, pancreas, stomach, breast, melanoma get to the liver, and therefore the treatment is entirely different and the approach is different. So when we talk liver cancer, think hepatocellular cancer and cancers that are secondary or metastatic. Now, today, again, as I point out, I'm talking mostly about hepatocellular cancer, which is cancer from liver tissue. So this slide, which says who's at risk, refers to that condition. So chronic hepatitis B, chronic hepatitis C infection, cirrhosis from any cause. It can be from alcohol, it can be from viral hepatitis, it can be from other metabolic diseases, especially massive or fatty liver. There seems to be an increased risk of liver cancer in people with metabolic liver disease, obesity, diabetes. Heavy alcohol and tobacco use is a risk factor. One interesting thing that I came across is a toxin called aflatoxin. Aflatoxin is a toxin that is in contaminated grains or peanuts. In fact, sometimes all of us taste peanuts that has this real bitterish taste. That's aflatoxin, and obviously a little taste like that won't cause it, but if you're eating contaminated peanuts that has this aflatoxin over a period of time, that's been associated in some countries with hepatocellular cancer. Hemochromatosis, the older age, the family history, all of these seem to have some minor increases, but really the big ones are the cirrhosis and the viral diseases. So how do we look for it? Everybody, therefore, who's got cirrhosis, we put patients on a screening protocol. So what's the screening protocol? There's a blood test called alpha-fetoprotein. The cancers produce this, so we look for that in the blood. You look for it every 6 months. And ultrasound of the liver, where we put some gel and use ultrasound waves to look at it, is a very common way. Sometimes we have to use bigger tools such as CT scan or MRI. There's a specific CT scan called triple phase. In other words, how we give contrast and how that contrast lights up the cancer in different ways. We would look for that. Symptoms are rare, but definitely any alarm symptoms like discomfort up here in the right side, in the belly, unintentional weight loss, jaundice, swelling, fatigue, loss of appetite in the setting of cirrhosis should raise one's alarm. So how do we lower risk? Most important thing, vaccinations for hepatitis B. Most children nowadays, as part of the universal immunization program, are vaccinated for hepatitis B. For those that are at high risk for liver disease or have liver disease or have cirrhosis, we routinely vaccinate them as adults. The second thing is chronic hepatitis C screening is now a thing for the birth cohort for the baby boomers. So, if you fall within that range, getting screened for hepatitis B is a good thing. Alcohol seems to be an independent risk factor, and more so important if one has any of these other chronic liver conditions. So if one has hepatitis C or B or cirrhosis, minimizing or avoiding alcohol, I think, is important. Smoking is also a risk factor, so therefore I think that seems to be a thing to avoid, in addition to the benefits of quitting smoking in many other organ systems. Metabolic liver disease, therefore, for all of us to aspire to be at the leanest weight, at the leanest amount of gut fat we have, treating diabetes, staying physically active seem to be helpful. There's some minor data that coffee consumption is protective. Therefore, it seems to be that it's just all these other plant products in coffee that seem to be protective to it, and not especially the caffeine. So it's that coffee, and that's a minor, I think, feel-good factor about people, coffee lovers, especially people like me. And then keeping up a 6-month surveillance on a cadence if one has cirrhosis with ultrasound and alpha-fetoprotein seems to be minimizing the risk. There is a way to approach this, and I'm still talking about hepatocellular cancer. The main approach seems to be we try to understand the tumor size, the number of tumors. Sometimes you can have more than one that spreads in the liver. The liver function, how functioning is the liver? Because cirrhosis, as we had talked about, can be across the spectrum. People do well, people do not so well, and then it's really end-stage liver disease where there is jaundice, yellow jaundice, there's fluid accumulation, etc. And these stages are graded as A, B, and C. So a lot depends on whether one is a A, B, or C. But overall, with hepatocellular cancer, the broad therapies include, sometimes if it's a small cancer and the liver is well functioning, resection can be an issue, can be an option. If there is more of a decompensated cirrhosis, liver transplantation can be an issue depending on the size and location. There are other modalities such as radiofrequency ablation and chemoembolization that are done. We don't do these two here. We work closely with University of Iowa, occasionally Mayo Clinic with this. And there are some systemic therapies where it can slow down and prolong life, which are pills, which are called multikinase inhibitors, and etc. And there are occasionally some clinical trials that are there. So in summary, liver cancer is preventable. Dial into hepatitis B, hepatitis C statement. Antiviral treatments can actually decrease the risk of hepatocellular cancer. Limiting alcohol, smoking, managing weight, diabetes, being active, making sure that you keep close communication with your liver doctors or your primary care providers are important, and continue to kind of think about other options as if one has liver cancer, to kind of continue to ask the questions. So keep thinking about this. It's an important topic. It's very important as we see several cases of liver cancer every month. If you have any further questions, please don't hesitate to reach out.